Good evening, esteemed members of the Pharmaceutical Society of Kenya. Good evening, our esteemed guest from InSupply Health. Welcome to today's webinar. Today's webinar is all about access to family planning in community pharmacies. We'll begin probably when we get to when the closest we get to 300 members who've joined us, or it's 7:05. 7:05 p.m. or 300 members who've joined us. That's when I'll be able to begin our webinar for today. In the meantime, on the chat box, let me know where you're joining us from kindly. Let me know where you are joining us from. Welcome, Dr. Nadia Batts, community pharmacist in Nairobi, Asante. So we're going to look at how accessible contraceptives and contraceptives are at the level of community pharmacy. Daktari, karibu sana. Zainab Makbul from Garissa, karibu. Beatrice Waroi Nyandarua, karibu sana. Susan Okonji, karibu, and Musa Kipet from West Pokot. Are there community pharmacies in West Pokot? Do they have access to family planning services? Esteemed attendees for today, ladies and gentlemen, members of the Pharmaceutical Society of Kenya, welcome to today's meeting or webinar on access to family planning in community pharmacies. I have requested as we're going to begin either when it gets to 7:05 p.m. or at 300 attendees. Today's meeting is basically on access to family planning, and it is in partnership with InSupply Health. So allow us to probably wait until 7:05 or when we get to 300 members. In the meantime, on the chat box, let us know where you're joining us from and which part of the country you are joining us from. Dr. Jidesh Dodia, karibu sana. David Gashie, welcome very much from Donholm. Donholm is in the east side of Nairobi. Our family planning service is accessible in the community pharmacies there. And I can also see a member of a closer member who's pharmacist who's closer to you, that is Dr. Alex Ogeti, Humane Pharmacy at Pedra. Are family planning services accessible to you at the community level? Dr. Nyanga Nyaberi, Kisii County, and Dr. Nazim Mohammed, Nakuru County. Today we are here to look at accessibility of family planning services, how family planning services accessible to your clients and members at the community level, at the community pharmacy level. We are getting close to 300 and both at the same time getting close to 7:05. Ladies and gentlemen, allow me to now begin. Welcome very much, Dr. Kenyanya from Tana River County. Allow me to begin. Today is our webinar on access to family planning communities in community pharmacies. The speaker for today shall be none other than Dr. Michael Mungoma, MPSK and Dean School of Pharmacy at Mount Kenya University. The webinar is hosted in partnership with InSupply. Welcome very much our guests from InSupply Health who are here with us today. So ladies and gentlemen, without further much ado, we go to the housekeeping rules so that we're able to begin. A few ground rules and announcements. Thank you first and foremost for participating in this session. Secondly, participants are all muted during the entire course of this session. Please ask your questions via the Q&A tab at the bottom of your window. Questions shall be addressed by presenters on the Q&A tab and after the presentation is over. For PSK members, if not already done so, please subscribe on the PPP portal for the conference so that you can get your CPD points. CPD points will only be awarded to paid up members. And for KPA members, the attendance list shall be shared with your officials for awarding of CPD points. A point to note is that this session is being recorded and will be made available on PSK's YouTube page. Apart from that, ladies and gentlemen, allow me to remind you again that we are having the Pharma Supply Chain Conference, looking at the accessibility, the cost-effective accessibility, the on-time accessibility, and the safety, safe availability of health commodities, health products, and technologies at the various supply chain levels in the pharma sector. And this, we're having a supply chain conference from on the 9th and 10th. That is next week on Wednesday and Thursday at Strathmore Business School. These are the charges. I'll create there. I will emphasize, let us register, let us joining even the physical conversation at Strathmore Business School, so that we are able to carry on the conversation and take charge of the pharmacy sector as it belongs to all of us. We go ahead to our agenda for today. Ladies and gentlemen, our agenda for today, welcoming and opening remarks from PSK. I am Bao Gitao. I do welcome you to today's meeting. Apart from that, I will welcome George Okelo. George, are you with us?
Yes, I am, Dr. Ari. Thank you so much for the opportunity to represent In Supply. I am here with my colleague Laura, and our colleague who's just stepped out, Johnson, is also following keenly. And so I think this is the time I'll get this opportunity to briefly introduce In Supply Health. I believe this is the time, Doc. Should I go ahead?
Yes, you can introduce In Supply Health, then we go to the presentation.
Thank you so much. So In Supply Health is a local company that mostly deals with various aspects of implementation. And one of the things that we pride ourselves in is our mission is to transform lives by co-creating innovation and sustainable solutions. And so one of the things that we are coming into this sector is on strengthening of pharmacy provision of contraceptives in Kenya. And most of us have been involved in the In Supply market test project. And so some of the things that we have as our unique and value propositions are that we are a local entity, but with a global perspective. And we contextualize some of the innovations that we are bringing home so that it's able to offer solutions that are scalable and sustainable within our context. And with this, we offer our services with empathy at core, where most of us, I believe, have been engaged on our first front of data collection, which involved the use of human-centered design, where we are looking into a deep commitment to understand some of the issues that are rising when we are offering contraceptives and other self-care products to our clients. And of course, there is the process in innovation, and at the center of this is your engagement as people, processes, and data, just to ensure that we have a lasting solution that is owned by us as individuals from the pharmacy fraternity. So I'll stop there to give an opportunity to Laura to say hi, then we can proceed to the next agenda of the meeting.
Thank you, George, and hello, everyone. Thank you for making time for joining this. As Dr. Ari said, this is sponsored by In Supply Health. George has given a good introduction to who we are. We are in this support and partnership with PSK and KPA. We are carrying out a project to test the viability of offering family planning by our healthcare providers at pharmacy level. So our pharmaceutical technologies and our pharmacists. This is going to be such an interesting discussion, and I always look forward to listening to Dr. Mungoma as he takes us through this. Asanteni sana. Back to you. Oh, okay, Tumbao, all right.
Asante. So ladies and gentlemen, without further much ado, allow me to welcome our speaker for today. Allow me to stop sharing my screen and allow me to welcome the speaker for the day. That is none other than Dr. Michael Mungoma. Dr. Michael Mungoma is a member of the Pharmaceutical Society of Kenya and sits at the National Executive Council of the Pharmaceutical Society of Kenya. He is also the Dean School of Pharmacy at the Mount Kenya University. And apart from that, he chairs the Education Committee and he's devoted to ensure that he's a self-advocate for family planning services at the community pharmacies. Dr. Mungoma, are you there with us?
Thank you very much, Mbao, for that introduction. I hope you can hear me.
Yes, I can hear you, Dr.
Yeah, thank you. So, good evening, everyone. Welcome to this webinar. Welcome the new pharmacists. I know there's always new pharmacists joining in the webinar. So the Pharmaceutical Society of Kenya is dedicated to ensuring that there's continuous professional development, and part of it is having educational webinars to ensure that we are well informed. I am Dr. Michael Mungoma. I am the Chair Education Committee of the Pharmaceutical Society of Kenya and also the Dean School of Pharmacy, Mount Kenya University. I want to acknowledge InSupply for supporting this series of webinars. So we're going to have several webinars that are geared towards providing family planning services in community pharmacies. So today I want to talk about self-care and family planning services in community pharmacies. Because it's a very, very important concept. You will forgive my computer. It's unable to do it in presenter mode. So I've tried to squeeze everything on the screen. So today we want to achieve certain things. First, to understand self-care. Second, to relate self-care and the community pharmacy. Thirdly, to explain the barriers to self-care in community pharmacies. And then to highlight DMPA subcutaneous as a modern contraceptive. So first and foremost is really just to talk about self-care, because it's a very, very important concept. I think it's taken center stage. It should have been a long time ago, but this is something that puts responsibility on individuals for their own health and well-being. You know, every time we remember this, I think there are several questions as we study pharmacy, and there was this particular question that kept coming. The responsibility or the health responsibilities belongs to who? Does it belong to the medical doctor? Does it belong to the pharmacist? Does it belong to? It belongs to the patient. So it is a broad concept that encompasses activities to establish and maintain health through to preventing ill health. The WHO defines it as the ability of individuals, families, and communities to promote health, prevent disease and maintain health, and to cope with illness and disability with or without the support of a healthcare provider. But again, we come in very, very strongly as facilitators to ensure that this is achieved. And community pharmacies play a very central role. I mentioned that in my previous presentation, that we are the closest to the community when it comes to matters health. So people normally weigh up the benefit they attach to good health versus the cost. It's a very sort of a natural way of looking at things. How much does it cost? So versus the cost of accomplishment, as has been encapsulated in the health belief model. So self-care is a continuum, starting with individual choices on health. For example, taking exercises or wearing warm clothes during the cold season, or eating fruits so that those can improve health or boost the immunity. Moving through to managing their own ill health, so self-medication, either on their own or with help. So as people progress along the continuum, more facilitation by others is required until a person needs fully managed care. And this is just an illustration of the self-care continuum that I've just been describing there. And it starts with responsible individuals, the daily choices people make, This could even include just managing the quality of air in your house, opening windows and so on, up to the very end where there's compulsory psychiatric care and major trauma that requires professional responsibility or pure medical care. And in that case, sometimes people will end up being hospitalized and require hospital care. Then there's facilitated self-medication. So when consumers seek help at the point of purchase, the pharmacist is usually in a strong position, a strong point to facilitate self-care decision-making by clients. So remember again, we are not the ones making the decision, but we are facilitating self-care decision-making. So self-care is not new. What is different now is the attitude towards self-care by policymakers, government, frontline healthcare workers. So there's a bigger recognition and an encouragement to promote self-care. Yeah, and this we've seen in legislation as well as policies that are being implemented. Just that. So the community pharmacy and self-care. Pharmacists are uniquely placed to provide support and advice to the general public, yeah, compared to other healthcare facilities. Why? Because we're very close to the people. We are the first point of call. We've had those phrases very many times. The combination of location and accessibility means that most clients have ready access to a pharmacy where health professional advice is available on demand, and that makes it very, very unique. Professional advice is available on demand, and that people don't have to walk long distances. And in fact, for those that are tech savvy, we have online services, including video calls, which is something that I think all pharmacies need to embrace because that is the way to go. So there are various barriers to self-care provision, and these are pharmacists' barriers to self-care provision that include: one, majority are not receptive to change, even when provided with the right conditions. So again, this is a very sort of common human behavior. Sometimes we are not very adaptive, yeah, even when provided with the right conditions. We'd rather continue with the usual, what we normally do. It's getting a prescription and dispensing. You're able to collect your money at the end of the day. Life goes on, yeah, and sometimes, yes, clearly the business expands and people are just okay with that kind of routine. The second barrier is time, funds, and limited support. Thirdly, lack of confidence in their own clinical ability and fear of taking on responsibility and accountability. It is important, and that is why I mentioned in the beginning, CPD, continuous professional development, is so key to ensure that we maintain certain competences of managing, managing clients or managing patients, or being responsible and accountable to what we do, especially as regards now in the context that we are in, family planning services provision. So lack of self-assessment for the need for training and reluctance to make autonomous decisions. We need to look at ourselves and see, what else do we need for training? Do we need PR skills? Yes, we have qualifications. Do we need PR skills? Do we need to training in certain specific areas? We could be having community pharmacies in areas that are maybe close to another healthcare facility. It could be a mother and child health facility, but you're not taking advantage of the fact that there is passing trade there, that you could actually provide further family planning services. Consultations sometimes are handled by staff without a pharmacy background, and we employ people, some of them sort of, in quotes, graduate from cleaners or people who support us in other ways, and they start handling from cleaning bottles on the shelves to handing them out to clients. And then after a while, unfortunately, these guys start providing information regarding medicines to clients. And that is a barrier. So among the role of pharmacists in self-care interventions for family planning, we say that family planning, is an important need that should be targeted in the community by healthcare professionals. So it's a need in the community. And we mentioned last time the statistics in Kenya and globally, and how contraceptives prevented over 200 million unintended pregnancies globally in 2017. Counseling and empowering clients by providing information on the delivering self-care interventions to maximize health benefits, including injectable contraceptives. So again, counseling, which is quite different from advising, because counseling here, we're engaging, we're getting to understand the client. The client understands you, understands the options, understands the product. And in that way, we empower them. Yeah, we empower them so that they also take responsibility and are able to account for their own health. So some of the self-care for family planning, so self-management includes self-injection, contraceptives. So self-medication, but of course that one is not in our jurisdiction, not our country. For voluntary termination, that is not for our country. For self-testing for sexually transmitted infections, pregnancy testing kits, and then self-awareness, fertility, ovulation predictor kits, and HPV vaccination awareness and sampling preparedness. So as regards the community pharmacy workforce, there are certain attributes that can enable provision of these family planning services. One, we have skilled staff, trained and certified, licensed to support the client with evidence-based, again, unbiased and sound advice about self-care. So unbiased, there's need for emphasis there, because usually in our routine work, sometimes we bring on our own biases, and they can interfere with provision of healthcare. Yeah, I've mentioned in my previous presentations, sometimes culture, religion, tradition can get into the way of service provision. Resourceful, community pharmacies can provide a friendly environment that is also credible, acceptable, and intimidating. It's easy just to walk there. You don't require filling out forms. You don't require, as a client or a patient, to come with a card, for example. Yeah. Knowledgeable, trusted, caring, confidential, and accessible. In an enabling environment, pharmacies are already equipped to store, handle, and dispense regulated quality medical products and interventions. And again, here it's important that we keep these quality medical products because I hear a lot people mentioning that there are these herbal products that are out there that have been apparently been mentioned as being very, very effective contraceptives, but are they registered? Are they, do we know about their quality and so on? So this enabling environment is one of the attributes again. The other one is national accessibility. Pharmacies have a wide distribution and long operating hours, including 24-hour community pharmacies. Yeah, and this geographical access again provides another opportunity to ensure that our clients are able to reach to us. Reporting and feedback. So education and training enables them to capture information as needed and report back to the corresponding authority, pharmacovigilance, to Pharmacy and Poisons Board, and also including for the family planning services reporting to the DHIS among the trained family planning service providers. So as regards family planning and contraception, this is a life-saving intervention. Yeah, with well-recognized health, social, and economic benefits. So the statistics are out there that if people are able to plan their families, and planning their families means they are able to space out their children and be able to make the right decisions as regards which methods are good for them, yeah, so that nothing is imposed, because there are several methods out there of contraception, but some of them may not be suitable for some specific clients for whatever reason. Access to family planning contraception, this reinforces people's rights to determine the number and spacing of their children. So hormonal and non-hormonal modern contraception methods include male and female condoms, injectables, pills, vaginal rings, diaphragms, implants, IUDs, and other permanent methods such as tubal ligation and vasectomy. So back again to this statistic that I was talking about. So over an estimated 308 million unintended pregnancies were prevented in 2017, and that family planning is meets people's need for modern methods of contraception. These methods would avert an additional 67 million unintended pregnancies annually. So there is a case out there, there's a genuine case out there of unintended pregnancies, and the numbers don't lie. So DMPA, we know it because we stock it, because we've heard about it, we dispense it. This is the most widely used progesterone-only injectable, yeah, and it's depomedroxyprogesterone acetate, DMPA, that is usually effective up to 4 months. But let's not get misled, it's effective up to 4 months, but clients are expected to come back after 12 weeks so that we have a certain level of consistency and ensure the contraception that is expected. So the injectable can be delivered into the muscle. So we have the IM, or just under the skin, the subcutaneous one. So when this is injected, the hormone is released slowly into the bloodstream. This is a very effective contraceptive. When this is injected on time, fewer than 1 pregnancy per 100 users will occur. And we know that it works by suppressing ovulation and also thickening the mucus to prevent pregnancy from occurring, because that simply inhibits the sperm from swimming. DMPA-SC. So it's a 3-month progestin-only injectable contraceptive containing 104 milligrams of DMPA per 0.65 ml dose. So it's normally administered in certain fatty areas under the skin. And it's important here that to mention that training is required, just to make sure that you know or you can advise effectively on where to inject. Remember, this is also a self-injectable product. So meaning clients can actually get to be counseled, advised, and educated on how to self-administer at home. So the World Health Organization recommends a self-administered injectable contraception, DMPA-SC, should be made available as an additional approach to deliver injectable contraception for individuals of reproductive age. And that in 2018, it included DMPA-SC in its revised essential medicines list. So this is also important. Among the experiences out there with DMPA-SC that we need to take note. So there was a study conducted in India, and it was about DMPA acceptance and compliance in a tertiary care hospital in Mumbai. And part of the information that came out of it was that the study concluded that DMPA is highly effective contraceptive with low failure rate when women are effectively counseled. So counseling again becomes a very, very important skill. And not only for family planning services provision, but I think just an all-round pharmacist should be able to counsel and be able to understand what counseling is about. That way, patients become more trusting. Patients and clients also become more, they can be able to approach your facility or community pharmacy with more confidence. And compliance with products, again, is enhanced. Other experiences out there with DMPA-C, which we are trying to give a focus in this discussion, is that long distances to clinics, long waits for service, and occasional stockouts of syringes for the intramuscular one meant too many women went home without receiving the family planning method of their choice. Yeah. And sometimes we see that also in our local facilities. DMPA-C is small, light, easy to use, that any trained person can administer it, including community health workers, pharmacists, and even women themselves through self-injection. So this is something that is highly recommended in terms of enhancing self-care, yeah, and enhancing choices out there for women. Or we can say this also includes ladies of reproductive or girls of reproductive age, because these are not excluded. Remember again that with the current situation, even in our own country, where we have teenage pregnancies on the rise, it is important to mention here that the government acknowledges and recognizes these and describes them as mature minors. These are teenagers who already have children, and that as mature minors, they should also be accessible or should be able to access contraceptives and be able to actually give consent by themselves. So other experiences, this was in Uganda. There was a study that was carried out in Uganda, and that was 2018, that part of the findings or part of what came out of it, there is further evidence that DMPA-C may be popular with young people, especially in community settings. And that is where community pharmacies are. So we have an obligation as pharmacists, as community pharmacists, to enhance our skills, to get ourselves to that level of competence where we are able to counsel and where we are actually able to administer. In my previous presentation, I mentioned that FIP has already defined the scope of pharmacies moving forward, and that also includes administration, and in this case, administration of injectable contraceptives. That brings me to the end of my presentation, and these are just some of the references that I used to compile this presentation. Thank you, and back to you, Mbao.
Hello, Dr. Ari.
Yes, hello.
Thank you very much for your wonderful presentation. I will now move to the part where we call upon George Okello. George.
Thank you, Dr. Ari. And I think when we're still bubbling with the knowledge and appreciating the new ideas that we've had, I want us to run through a poll, or rather an interactive session, where we'd like to hear your thoughts on factors or issues around bubbling, as in kuchemka, sio bubbling of not bubbling of incoherence, bubbling of kuchemka, when we are still hot with ideas. So what I want to share is my screen so that we can interact using Menti, and we're going to do this. So allow me to share my screen. Doc, you can stop sharing your screen so that I can share mine, then I take the team through how to log in. Okay, so very quickly, I hope you guys can see my screen.
Yes, George, I can see your screen.
Thank you. So for those of us who've interacted with Menti, I think you know the drill. But for those of us whose this is their first time, please take your devices. If you're using your phone or your laptop or whatever gadget you're using, please get to your Google and just type in the word www.menti.com, and then you will have a pop-up of the Mentimeter that would request for a code for you to use. So as we are doing that, please, Johnson, please type for us the code on the chat so that those of us who've been able to access the Mentimeter poll from their phones or laptops can start logging in, and I can see from my end. Are we all there? I think we could just raise our hands if we able to log into the Mentimeter so that I can have the shortest time for this interactive session. Okay, I would request us to hit the button so that we are able to. Thank you. I'm seeing responses have started trickling in. Let's continue responding. Please try and elaborate more. What might prevent clients in your pharmacy from seeing you or pharmacies as their trusted primary provider for contraceptives? So when you talk of privacy, please elaborate. Is it privacy from your end, or is it privacy from the client side? So we can have that interactive discussion and just get to know more of the issues that are rising. I can see only 7, and we are about 481 participants. The number is rising. 10. Let's log in. How many are having challenges? The Menti code is 2100728. Let's keep the responses coming. Thank you. 19. Let's hit 100. Let's hit 100 from the participants. Thank you. Identity. One would find it more appropriate to access it in a private setup where they are not known or easily identified. So there is still stigma. Keep the nice responses coming in. We are at 40. Let's have 60 more people join. The Menti code is 2100728. Just go to www.menti.com. Thank you for your beautiful responses. I'm expecting more. Insecure, please elaborate. Feeling shy, true. We're almost there. Let's hit 100 before we move to the next question. What might prevent clients in your pharmacy from seeing you or the pharmacy as their trusted primary provider for the contraceptives? Keep them coming. I don't want to lock anyone out. You can provide as many responses as you can. You're not limited to one response. High cost. Thank you. Privacy. Confidentiality. And we've hit the 100 mark. I'm seeing a request that we hit 200. Please try and respond on the Mentimeter. If you're having challenges, just go to ask for help. You can go to www.menti.com from your phone or your laptop, and we'll be able to assist you. Log in if you're having challenges. The Menti code is 2100728. Thank you. Have we exhausted this so that we go to the next question? So the next question, number 2, what are some of the barriers you face in providing quality FP services to clients? And this range from counseling, as Daktari had mentioned, to offering the real service like selling or even doing the DMPA SC or IM. Thank you. Good responses. Let's hit 100. Thank you for your responses. Keep them coming. Keep them coming. Inadequate privacy, ignorance. Okay. Inability to administer parenteral preparations. Patients are not open enough. Time factor. high workload, stockouts, good. Cultural beliefs, thank you, keep them coming. Let's hit 100. The Menti code is 2100728 for those who who are still having challenges logging in. Go to www.menti.com and use the code 2100728. Stigma, consultation, limited spaces. Thank you for your feedback. Not any at the moment. That person is not fully engaged in it and was doubtful of the regulation. I think we'll be able to clear the air once we move ahead with the curriculum and issuing of FP at our community pharmacies. Keep them coming, keep them coming. Technical knowledge, thank you. Antagonizing information, okay. Trust, age, great. Mistrust. Myths and misconception. Stockouts. Okay. I can see some more are joining. Thank you. We're almost hitting 150. Great. We'll have another run with this. So let me go to the next question. Failure to follow up to check how the patients experience using the FP, great. That is so good. Many pharmacies do not have counseling rooms and injection rooms, inadequate skills to administer injection. Normally immunization is free. Okay, please elaborate. Good responses here. Provider bias to certain methods. Good, good, good. Stockouts. High cost. Patients shying away. Two more. Two more. Great. Wow, very good answers here. I hope you can also see them trickling in from your end. So let's move to the next question. In your opinion, how can counseling clients who visit your premises for contraceptives be strengthened? Dr. mentioned in his presentation that there's a difference between counseling and just advising. And so one of the things that we've raised or you've raised consistently is inadequate skills. Rooms are not big enough to offer counseling services. So how can we strengthen counseling to clients who visit our premises for contraceptives? Thank you. Let's keep them coming. Adequate time. So how do you develop trust, more trust and equip yourself with more knowledge. So how can you make the clients trust you? What do you need to do? I'm just pushing on so that the person who's mentioned building on trust to give us more, we need to hear. Stubborn husbands. Great, that's a good one. Give them your time. So we're agreeing that time is very important. Pharmacy rotas, sufficiently staffed with pharmacists. Great. Enhance your privacy. Enough knowledge of different types of contraceptives, patient awareness, gain the confidence of clients. Let's keep them coming. The code is 2100728. Just get to www.menti.com and we'll be receiving your responses. Mass education on FP, okay. Take more CMEs on contraceptives, job aids and displays, public information to get counseling in pharmacies. I like that. Adequate privacy, enabling environment, good consultation rooms. Keep them coming, guys. Thank you. How can we strengthen counseling to clients who visit our premises for contraceptives? Let's keep the answers coming. Take the initiative to lead from the front. I believe this is about you also getting the family planning if you're a lady, okay? Know your medicines. As a healthcare provider, have information on your fingertips regarding how FP medicines work, possible side effects, other relevant information. You cannot counsel while your confidence is shaky at best due to lack of adequate knowledge. Thank you so much. Very elaborate, on to the point on how to develop our confidence and make our clients trust us, and ways of strengthening our counseling for those clients who visit us for contraceptives. Keep them coming, guys. Thank you. Good follow-up. Affordable prices for contraceptives, yes. Flyers and booklets when they leave. Display of posters. Easy to read pamphlets, good idea. Being honest with the clients, giving facts about FP increases trust. Give the patient more time, empathetic listening. Thank you. We need 2 more. We are at 98 on this tablet, 99, 100. Who wants to get it to 110? Thank you. In your opinion, how can counseling clients who visit your premises for contraceptives be strengthened? Affordable prices, that is come out a lot. Privacy is the talk of the day. I can see it coming over and over, reassuring the patients, polish the inadequate skills, creating a good rapport with the clients. How do you do that? Let's hit 110. Adequate time. Thank you guys for your answer. We are in the last question. It has 2 parts. Which are some of the self-care products that you are aware of or you've ever stopped? This is a direct one. Daktari mentioned a few in our presentation today. So let's keep them coming. Which are some of the self-care products that you are aware of and you've ever stocked? Pregnancy test kits, good. Femiplan pins, great. Condoms, keep them coming. Depo. Thank you. Condoms. Yes. Let's keep them coming. Lawash. Okay. HIV Aura Quick. Condoms, PT strips, pills, Depo-Provera, B-Wash, Durex condoms, Sure condoms, great. Jadel, PT strips, COCs, PrEP, great. HIV, syphilis, duo test kits, great. I like that. The malaria RDTs, EC pills, Femiplan. Microgynon, great. Microlute, pregnancy test kits, pessaries, yes. Keep them coming, guys. Let's hit 100. Let's hit 100. Don't shy off, even if you see somebody has already written condoms or PGT strips. Just write, because that is what you've stocked and that is what you're aware of. Thank you. Posters, okay. Please elaborate. Posters. Or this is a right answer in for a wrong question. This should be question 3, I guess. Evening pills, okay. Please clarify, are we talking about those evening pills? Machines, yes. We have the BP machines, blood glucose monitors, multivitamins, probiotics, supplements, insulin syringes, Mirena coil, okay. Ovulation kits, Jadel. And I can see there is a lady called Diane 35. Okay. Depomedrol. I believe this is not CBC, the one we know. Thank you. Mirena, IUDs. Okay. IUDs are also self-care products. Okay. I can see a nerve's place as one of the self-care products. I can see a name that is familiar, P2. Okay. So sanitary towels, good. Cyana Press, COCs, PrEP, PEP. Keep them coming. Thank you, guys. And we are on to the last question. Let me have this running for a couple seconds. KY jelly, yes. Play safe, lubricants, ovulation kits, plan B, okay. Okay. So I believe the evening pill was the plan A. Pregnancy test kits, Viagra, good. Vega. Thank you so much. Let's get to the last question of the day. Which other self-care products are on demand and you're willing to stock? These are questions that intends to find out what are some of the things that your clients come asking and you're not currently stocking them, and they fall under the category of self-care products. Let's keep the answers coming in. Let's keep them rolling. Herbal remedies, good. Sun cream, okay. Lab equipment, Arimis, okay. Great, that's a good one. That's a good one. The one with the green bottle, or the new and improved version. Thank you for that. Oximeter, yes. Cosmetics, right. Let's keep them coming. Let's keep them coming, guys. Thank you for your responses. Cosmetics, safe COCs, sildenafil, gels, RDTs, cosmetics, beauty products, skin lightening products, okay, BP machine, oximeters, COVID rapid test kits, roll-ons, post-2 sun creams. I was about to say sunscreens, contraceptive patch, typhoid test kit, okay, gummies, sanitary pads, self-sun. Keep them coming, guys. PrEP, PEP, microfine insulin. Wow, COVID vaccines, nice. Okay. on my right, the farthest corner, it's scrolling up. Johnson, read for us that one. We have multivitamins, baby powder, KY jelly. Oh, massage room, nice. Okay. I believe this answer is in the right place. Massage room as a self-care, therapeutic massage, HIV, syphilis, the duo kits, anti-abuse, blood pressure machines, female condoms. Which other self-care products are on demand and you're willing to stock? Let's finish this with a bang. www.menti.com. The code is 2100728. It's up here. You can read through. RDTs, gels, safe COCs. Let's hit 100, guys. 20 more, 20 more. Let me get 20 more responses. You can repeat, it's okay. Blood sugar machines, some cosmetics, sanitary pads, nail clippers, pregnant care gummies, microfine insulin. Okay. Self-test kits, PrEP, Femiplan, COCs that are mostly found in public hospitals. Okay, that could be a trust issue. There are those who believe that drugs from the hospitals or the public hospitals are original compared to when you compare them to the others in the pharmacies. Slimming tea, herbal remedies, sunscreen, dental services, and abuse. Thank you so much, guys. I think I want to appreciate your responses, and it has been rich. The responses are so rich in content. So I want to take this back to, Daktari. I'll stop sharing my screen. Back to you, Daktari Mbau. Thank you. I think we'll be able to pick those that we are seeing on the chart, those who are unable to join the Menti, subacute depot, tampons, and such. So back to you, Doc.
Asante sana. Thank you very much. So we now go to the Q&A section. So probably, Dr. Mungoma, you're still there with us?
Yes, I'm here, and I think I just want to say I'm really impressed by the interactive tool that we had this evening with facilitated by George, and also the sort of answers we've been getting from the questions. Back to you, Mbao.
Asante. Thank you, Dr. There's an anonymous attendee who's asking, are birth control pills 100% effective?
Now, that's an interesting question because with contraceptives, and especially birth control, one, there are very many types of birth control pills. Yeah, ranging from the emergency contraceptive to combined oral contraceptives to progestin only. However, the effectiveness is always slightly less than 100, depending on very many things. One, compliance, depending on compliance and when they started taking the contraceptive pills, and even with the pharmacology that we know, it could be drug interactions. They're probably taking other drugs at the same time, and other unknown factors that can influence the effectiveness of birth control pills. However, it is important to mention that they are effective oral contraceptive pills out there, and it is just a matter of understanding them better. And second, as we're going to see in our subsequent webinars, there is something known as medical eligibility criteria, MEC, which is going to be a very, very important tool in determining which method is best suited for a specific client, and that there is a criteria and the methods of the ways of looking and counseling the patient to determine that. Bao?
Asante Daktari. So probably as we are preparing for the next meetings, are you able to respond to the second question from Josephat Misango? Is spermicides classified as a contraceptive?
So that is an interesting question because, spermicides, spermicides themselves are, they're considered a birth control. And actually, they are a contraceptive because a contraceptive, by definition, is something that is designed to prevent pregnancy. One of those methods that are out there that contains spermicide also includes sponges, and these are contraceptive methods. So yes, depending on how that spermicide is presented, it is still a contraceptive. But again, I think it's also important to remind people of the definition of family planning, because as much as we are focused on the product, we really need to remind ourselves what family planning is. And this is something that allows people to attain their desired number of children, if any, and to determine the spacing of their pregnancies. Yeah. So this can be achieved, again, through use of contraceptive methods and also addressing infertility so that we have a very holistic view on family planning and not just the products that are on the shelves.
Wonderful, wonderful, Daktari. So probably as we're continuing, you can tackle the next question on the youngest age to administer and maybe, or is it at puberty?
When are you saying, when did you, when?
The youngest age to administer a family planning services, or is it at puberty?
That is you see, that is an interesting question, because like I said, family planning is all about spacing of children. Yeah? So if you are talking about giving family planning services to children, one, that statement itself is I could say it's a bit controversial. I mentioned in my discussion earlier that the government recognizes people below the age of 18 that have become pregnant and gotten children, and those are classified as mature minors. So unless we are discussing mature minors, we cannot say that we are going to administer contraceptives to children. I don't know whether that answers the question.
Yes, that answers it very well. And when can one recommend breastfeeding mothers to shift from POP to COC? That's probably on the.
So again, this, like I said, we are going to cancel this. We're going to cancel the client. When we are thinking about shifting POPs to COCs, we also have to look at how long is she planning to breastfeed. Ideally, we're supposed also to be encouraging these mothers to take on breastfeeding for at least how long? About
6 months exclusively.
Yes, and even more. Yeah, that is just a minimum. So if somebody probably wants to now move on to stop breastfeeding, then that discussion has to come into play first, meaning there is no special time. Counseling has to take place to ensure that even as you're providing that alternative as the family planning service provider, it is the best for the mother and the child, so that you have a very holistic approach to determining that. So there's no specific time or no specific date for shifting. But ideally, encourage the mother to exclusive breastfeeding until such a point where now they feel more comfortable, then they'll be able to shift.
Wonderful, Dr.
So maybe even as we continue looking at some of the questions, maybe I just want to mention here, I know people are getting into very, very specific questions for the various contraceptive methods. We are going to have subsequent sessions where we get into the specifics. So I want to encourage people to have their questions limited to the discussion of the day. I know it can become very, very interesting, and there are a lot of scenarios out there in community pharmacies. I worked in one, and there were very, very different scenarios. So if we can just limit our questions in the scope of the discussion today, so that we allow other people also to yeah, Bao.
Wonderful, Daktari. So probably what you are saying is that the trainings, there's a question that has been asked is, are we going to train more on family planning? The answer is yes. And probably they should probably be joining our webinars more and more to be able to interact and get to know more about the various contraception methods as we try and decipher this topic on family planning. So allow me, Daktari, to probably end it with a question. Let me see if there's a question that needs your attention. Or you can also look at through the Q&A tab, Daktari, to see if there's a question that needs your attention.
Yes, now somebody asked there again, how safe is for a client who has been given IM depot injection and has had unprotected sex within 7 days after the injection? Again, it all comes back to when was this? Was it done at the right time within day 1 and day 5 of the cycle? And usually if these clients are sexually active, you'd want to advise the client to use additional contraceptive methods of protection, maybe even up to 5 days after the injection, just to ensure that they are protected. So I think that might answer the question, because the question just talks about within 7 days. It could be day 1 or day 7. Back to you, Mbao.
Asante, Daktari, thank you very much for your response. So probably let's get a partition from George. George.
Thank you, Daktari. I think for me, this is one of those sessions that we're really excited about the feedback and the responses that we're getting. And we are interacting with the teams who are actually offering these services. And so when they say that there is inadequate space, a lack of privacy, we take that and we see how we can, when we go to the co-design and when we'll be doing modeling, we'll see how some of the prototypes and some of the services that we'll be co-designing are to the benefit and to address some of the challenges that you face. I think at this moment, I just want to throw the mic back to Laura so that she can have her closing remarks. And yeah, Laura, back to you.
Asanteni sana. Some of the comments I've seen is how interactive this session is. As Mbao has said, we're going to have a series of these webinars, and more we're going to demystify this and also give back our pharmacists and pharmaceutical technologists. Our health-seeking behavior in Kenya is such that we're going to pharmacy first, and we know this. So how can the pharmacy be our one-stop shop, even for self-care products? Of course, offering referrals as required, being the healthcare providers and the first point of contact. In Supply Health is carrying out this project and trying to build viable business models, more women accessing family planning and self-care products through pharmacy, and seeing how then we can unburden the private sector. Very interesting questions on access. We're going to see how to address some of that going forward. And we look forward to more interruptions. I want to say a big asante for all the attendees, all 429, and all those then who are able to get into Menti and answer. For the panelists, I'll request Dr. Anyona Johnson to please say hello. He had something running in parallel and was able to come and join us. Dr. Anyona? And he's on his commute, as you can see. So he's driving at the moment. He's just left the office. George is still in office. We sincerely appreciate what we've done. Daktari, thank you. Always insightful, always leaving me looking forward to the next session. And PSK Fraternity and for the partnership, Asanteni Sana for having us and for partnering in Supply Health. Back to you, Mbao.
Asante, Madam Laura. Thank you very much, and drive safely, Dr. Johnson Anyona. And thank you very much, George, for taking us through the interactive session today. Thank you very much, Dr. Mungoma. Probably now, ladies and gentlemen, without further much ado, allow me to welcome none other than the CEO, the Pharmaceutical Society of Kenya, that is Dr. Lucas Nyabero. Daktari, are you with us?
I am with you.
I can hear you loud and clear, Daktari. Karibu sana.
Thank you very much. I just want to welcome everybody again. Thank you so much for attending this session. Amazing presentation by Dr. Mungoma, always eloquent, on point. I really appreciate that. And then our host, Dr. Mbao Gitao, very beautiful, beautiful radio voice, TV voice, you know. Thank you so much for that. And the questions, the answers, the interactions, quite spot on. And we're going to go for more. We're going to have more sessions like this. And this is a very interesting topic. It is fraught with a lot of religious issues, cultural issues, and more. I think one of the things that we agreed to when we joined healthcare is that we are going to be able to serve all equally. So if you're going to do that, it's good to have the knowledge that you need so that when somebody walks through your doors and asks you for something, you can confidently and happily be able to share that. So thank you so much for joining us, and continue joining us, continue to support us. Make sure you're a member, paid up member, so that we can have the resources that we need to grow the profession of pharmacy. How do we make sure as the first contact of most of the healthcare personnel, of the healthcare seeking, and the public seeking healthcare, if we are the first, how do we make sure that we direct them correctly? So I won't keep you much longer. I truly appreciate each and every one of you. And thank you for joining us, and looking forward to seeing you in the next webinar that we'll have. And remember what you can see on your screen, the supply chain conference that is coming up. There's a lot to learn, a lot to understand, a lot to enable you, to tool you up to be able to perform the functions that you like to perform for your public. So thank you so much. Barikiwa sana. Tutaongea. Back to you, Dr. Mbao.
Asante sana, the CEO. Thank you very much, Laura and George. So probably for those who remember during Mzee Moi's time, when Mzee Moi will complete speaking, nobody else will be allowed to speak after him. Mine is just to welcome you during the Pharma Supply Chain Conference. Ensure that you register to join us either virtually, and you're encouraged to even join us physically. Lilo na mwanzo wa makweli lazima liwe na mwisho. Sina budi ila kuwaaga, muwe na usiku mwema, alamsiki.
Thank you. Bye.
Thank you very much, everybody. Thank you.